Marshall, checking off Blair Boyette on NG tubes and catheters. It's February 6th, it's Thursday. The scenario is that you've entered the room with a female patient admitted with a small bowel obstruction who's been vomiting frequently. Following appropriate red rules, you need to place a NG tube in order to decompress the stomach, and in preparation for a small bowel resection, prep your patient for the OR by placing a Foley catheter.
Okay. All right. So I'm going to come in and introduce myself to the patient. Hi, my name is Blair, and I'm going to be first inserting an NG tube, and I'm also going to be putting a Foley catheter. The NG tube, it can be pretty scary, but it's just going to be a little discomfort for a little while, and I'll walk you through it so it won't be that bad. And I'm just going to verbalize, I would put on clean gloves. This is a clean glove process, not a sterilized process. So I would start by, I'm just going to curl this up so that when I go to put it in her nose, that it'll go smoothly down her esophagus. Okay, and then I would lube if I had lube. And then I'm going to have her in high Fowler's position, and then she would help me sit up, and then she would look up just to help this go as straight down as possible. And this isn't working too well. Okay, so I can't get that, but I would keep doing this all the way down until I hit her throat, and then I'll have her look down, and then I would have her drink a sip of water, she would swallow, and then move it 1 to 2 more inches down, swallow, same thing, and until it went all the way down to here. And how I measured this would be from her nose, around your ear, and down to her xiphoid process. And I would move that all the way down there. And typically, the best method for checking the placement of the NG tube would be X-ray. And there's also aspiration and pumping a few cc's of air in there to listen with the stethoscope. Okay, so that's in. And next I'm going to move to sterile gloves and Foley catheters. Before I start with my sterile process, I'm going to roll this up. I'm just going to position her legs in a way that will make it easy for me to put her Foley catheter in. And I think that's staying. And then I'm just going to roll this up here. And before I would do sterile gloves, I would do like a clean water and soap first, just to get rid of any excess like fecal matter that was around there. And then once I did that, I would throw away, wash my hands again, and then I would start the sterile glove process. So I'm going to, this will be like this. I'm going to set this over here. Trying to keep this away from touching anything. Okay, and so now I'm going to put on my sterile gloves. And so I would grab this. I'm going to put these on over here, and I can touch the 1-inch margin on the outside. And then pick this up and guide my hand through. And then like that, and then that's not really fixed, but I can fix that after I get this glove on. Okay, and then I fix this. Okay, so I have my sterile gloves on. So next, I'm going to take this and do, look for the shiny side. And the shiny side is going to go down. And I'm can use the folding over method. I'm going to put this right here up under her. If this was a real patient, I would ask her to sit up so that I could push this underneath her, but since I can't, I'm just going to put it under there, making sure my sterile gloves didn't touch her or anything that wasn't sterile. And so next, I'm going to put this next sheet over top of her. And then gonna lay it over like that. Okay. And so before I begin any of this process, I would ask her if she was allergic to iodine or shellfish, considering that iodine contains, I guess, shellfish matter in it. And then I'm going to set up my sterile field so that I have everything organized and ready to go for when I start to clean her up. I'm going to take these out, and this is all sterile. Okay, so I have this out, and I'm going to go ahead and squirt my iodine here. Okay, so I'm just going to hold this. Wait, before I do this, before I get this hand dirty, I'm going to take this out and set it on the sterile field. And then I'm going to put this right here and squirt lube on it. Right there. Okay? So now I will take this and hook it to the side. And it would have water in it. I would pump this up, make sure the balloon inflated. It did, and I'm going to keep that connected. Okay, so that's all ready to go for when I get ready for that. And then I would do this cotton ball right here, and I would do top down. And then I would throw this away. I'll make that as my trash can. And then top down, trash can, and then I would do middle down. And then that all had iodine on it, and so she's clean and ready to go for the Foley catheter. And now first I would start, and I'm going to wrap this. This has been in the lube the whole time. So I'm going to wrap this around. And then I'm going to move this over to my sterile field. And then I'm going to start by inserting it. And then if I felt any resistance, then I would stop. But I'm going to keep pushing this in until I see urine. And then once I see urine, I'm going to push it in 1 to 2 more inches further. Okay, and then so that's in, and I see urine, so I'm going to take this and inflate it so that the balloon is inside our bladder. And then to check and to make sure that it's in there secure, I would just tug gently on it to make sure that it was inside of her bladder and not somewhere along the urinary tract. And so, yes, okay, and so I'm done with sterile field because I got everything in, and I'm not going to be touching necessarily right there. So I'm just going to, I would normally rip this off, but we can't because of the video, but I would take this and tape this to her leg, and then I would hang her catheter bag over here on the bed frame, not on the bed rail, so in case that she sat up or something, it wouldn't come sliding off or get tangled up. And I believe that's it. All right.